Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. I am Professor Adam Ahmed Adam. You are welcome to this bacteriology lecture. It is about Campylobacter species. They cause Campylobacteriosis, which is an enteritis. It is a zoonotic foodborne bacterial disease. Campylobacter species are gram-negative S-shaped bacilli as you see in the upper picture. This is a gram stain. They are motile with amphitrachus, that is say bipolar flagella, one flagellum in each pole as you see in the lower picture. They are non-spore forming. They are encapsulated. The capsule is a polysaccharide capsule. They are microaerophilic. They grow at low oxygen concentration, 5% oxygen. They are thermophilic. They grow at a temperature of 42 degrees Celsius. There are multiple species of Campylobacter, but the main species that cause human disease are one Campylobacter jejuni. This is the commonest cause of Campylobacteriosis. It causes about 90% of cases. 2. Campylobacter coli, 3. Campylobacter lari, and 4. Campylobacter fetus. These bacteria have virulence factors that mediate the disease process. These are 1. Flagella. They facilitate bacterial colonization of the intestinal mucosa. 2. Adhesins. They facilitate bacterial adherence to intestinal mucosa. 3. Toxins. They produce endotoxins and exotoxins that participate in the disease process. 4. Invasiveness. The bacteria have the ability to invade the intestinal mucosa. Sources of infection. The bacteria are found in intestines of infected warm-blooded animals, and from them the contamination occurs. The disease is mainly foodborne. The infection takes place by ingestion, swallowing of contaminated foods and drinks. The contamination from the source, for example, poultry, this is important, water, unpasteurized milk, undercooked meat, and other food items. Also, the contamination of foods and drinks may be from contaminated cooking utensils and cutting boards. The cooking utensils are the containers and instruments used in cooking. The cutting boards are commonly wooden boards used for cutting of meat and vegetables. Nota bene, I'd like to draw your attention here that the taste and smell of food may be normal. A small inoculum amount of bacteria, about 500 cells, is enough to cause the disease. Direct contact with infected animals can also lead to infection, mainly occupational, people who are in contact with animals. This diagram illustrates the chain of infection of Campylobacter. We start from where the red arrow is pointing, the animal reservoirs. Different animals harbor the bacteria. From them, the bacteria are spread. So human can be infected by eating or drinking of the food products from animals, such as contaminated meat, contaminated unpasteurized milk. Also, human can be infected directly from the animal reservoirs through flies, rodents, wild animals, and farm workers. Also, these animals can be infected by the same vehicles from the infected person. The infected person sheds the bacteria in his or her stool into the environment, leading to contamination. contaminating water, feed the animal food. And also, animal can be infected from the infected environment. By this, the chain is completed. Pathogenesis, the mechanism of disease. Low gastric acidity helps the bacteria to survive and flourish. Higher inocular may result in shorter incubation period. The infection is typically established in the distal ileum and colon, and initially causes a non-inflammatory diarrhea, which is secreted diarrhea, followed by intestinal invasion, leading to cell damage and inflammation that ends up into bloody diarrhea. Bloody diarrhea is known as dysentery. The bacteria may also invade the blood, causing bacteremia. There are immunologically mediated diseases that may occur post-infection, after infection, due to antigenic mimicry of specific Campylobacter jejuni, because this is the commonest antigens with certain body antigens. Antigenic mimicry means antigenic similarity. These diseases are one, Guillain-Barré syndrome. It is a neurological disease. It is a flaccid paralysis. It occurs 1 to 3 weeks after the onset of enteritis due to the autoantibodies. 2. Reactive arthritis. It occurs 1 to 6 weeks after the onset of the enteritis. The stimulated T lymphocytes, stimulated by the bacteria, react against the joint synovia. The clinical manifestations appear commonly about 2 to 5 days from the time of infection. This is the commonest incubation period. An incubation period of 1 to 10 days was also noticed. The cases are mostly sporadic, rarely epidemic. Few isolated cases in the community. The patient presents with diarrhea, frequently bloody, that's dysentery, abdominal pain, fever, headache, nausea, and vomiting may occur, occasionally bacteremia. Symptoms and signs spontaneously last about 3 to 6 days after their onset. Because the disease is usually mild and self-limiting, commonly the patient recovered without medical intervention. But the disease can be severe and rarely fatal among very young children under 5 years of age, elderly people above 65, and immunosuppressed people. Complications, relapse, recurrence. The disease may come back again, and this is very common among the at-risk people, such as young children, elderly, and immunosuppressed. Cholecystitis, the infection of the gallbladder. Meningitis, the infection of the meninges. Hemolytic uremic syndrome. In this disease, we are going to find hemolysis of red blood cells in addition to renal failure, bacteremia, and irritable bowel syndrome. Diagnosis, clinical assessment, then laboratory investigations. The specimens to be collected are stool, usually contains mucus, pus, and blood, rectal swab, and blood if bacteremia is suspected. The investigations, stool antigen test to detect bacterial antigens in stool. Polymerase chain reaction, PCR, to detect a specific bacterial gene in stool. Specimen culture, the bacteria are fastidious, that is exacting in growth. They need certain growth requirements in certain amounts. Specimens are cultured on selective media, the media that inhibit the growth of other bacteria, allowing the growth of Campylobacter. Charcoal is added to remove oxygen radicals. Antibiotics also are added to inhibit the growth of other bacteria, and the agar the medium is enriched with blood. The culture is incubated in a microaerophilic atmosphere, 5% oxygen, 10% carbon dioxide, and 85% nitrogen at a temperature of 42 degrees Celsius for a duration of 48 hours. Culture findings: gram-negative S-shaped rods or bacilli, oxidase positive and catalase positive bacteria. Treatment: Campylobacteriosis is usually mild and self-limiting. The patient commonly recovers without medical intervention. Fluids and electrolytes replenishment if needed, if the patient is dehydrated. Antibiotics are given in severe cases, commonly among the under 5 years old children, 65 years old or more people with low immunity. These antibiotics are macrolides such as azithromycin or erythromycin. Also, fluoroquinolones can be used such as ciprofloxacin. Prevention: improvement of personal and environmental hygiene, safe disposal of sewage, provision of safe water for drinking and other domestic use, microbial control on all stages of food chain, thorough cooking of food, the whole food, bulk, so as the temperature to reach the whole components of food. The bacteria are killed at a temperature of 65 degrees Celsius and more. Taking care not to get infection from animals, especially poultry. Vaccination with an inactivated vaccine. By this, the lecture is over. I hope that it is understandable, and I wish you all the best.